All right, ready to dive in. Today we're tackling gunshot wounds to the torso, and trust me, it gets complicated.
Definitely. We're going beyond the headlines here, using this medical source, gunshot injuries to the trunk, to really unpack the realities of these injuries.
No sugarcoating. We're going for the nitty-gritty. So first off, you hear gunshot wound. It's serious, right? But how serious are we really talking and why?
That's where this source gets fascinating. It's not just about the bullet itself, it's about the physics at play. And believe it or not, speed matters more than you might think.
So we're venturing into the realm of kinetic energy, right? That whole mass and velocity equation.
Exactly. And while we won't bore you with the math, the key takeaway is that velocity plays a much bigger role than mass. A small, fast bullet is way more dangerous than a large, slow one.
Okay, so picture this. I chuck a pebble at you, really beaning it, versus just lobbing a basketball. That little pebble's going to pack a bigger punch, yeah?
Perfect analogy. Think about rifles versus handguns. A rifle bullet, even a small one, is moving crazy fast. That force, concentrated in a tiny area, causes some serious damage. A handgun bullet is bigger, but it's slower, so the impact just isn't as severe.
But here's where it gets really wild. The source mentions this thing called cavitation. Sounds kind of sci-fi, right?
It's pretty intense.
Yeah.
Cavitation is what happens when a high-speed bullet doesn't just pierce, it creates a shockwave inside the body, like an internal explosion, damaging tissue way beyond the bullet's path.
Wait, so even if the bullet misses a vital organ, the shockwave from it can still wreak havoc. That's terrifying. How does that change how we think about emergency response?
Completely changes the game. Think about shotguns. Up close, they're devastating, but the pellets spread out, right? That energy dissipates fast. Those individual pellets just don't have the velocity for that intense cavitation.
So velocity is key. But our source says it gets even more complicated when a bullet actually hits the body.
Because the human body isn't a stationary target. The bullet's angle, whether it's spinning, all that impacts the damage.
We're talking yaw and tumble. Yeah.
Exactly. Yaw is basically how much the bullet deviates from a straight line. Like throwing a football, a tight spiral has less yaw than a wobbly pass. Tumble is when the bullet is literally flipping end over end as it flies.
Yeah.
And here's the kicker. The later a bullet starts to yaw, the deeper the wound.
So a spinning, wobbling bullet is bad news. More destruction inside the body.
Exactly. And that's why treating gunshot wounds is so complex. The entry and exit wounds, while helpful, don't tell the whole story.
The source even uses the term secondary missiles, which sounds pretty gnarly.
Yeah, it's not pretty. Bone fragments, bits of clothing, even parts of the bullet itself all getting carried along, adding to the internal chaos.
It really makes you think there's so much more to it than you see in the movies. Okay, so picture this. The ER, chaos, sirens, you're the doctor. A GSW patient arrives. What's the very first thing on your mind, those crucial first few minutes?
It's all about stabilization in those first moments. Our source lays out the immediate priorities: airway, breathing, circulation, making sure the patient's stable.
Like a rapid-fire checklist, but with, life or death stakes?
Exactly. Speed is essential, but it's not just about rushing. The source stresses a systematic approach: X-rays, fast exams, quickly assessing internal damage.
And every second counts in those situations.
Absolutely. One study in our source looked at delaying aggressive fluid resuscitation. You'd think pumping fluids would be the go-to, right? But holding off till surgery actually made a difference.
Now that's wild. What's the logic there?
It's counterintuitive, but delaying that aggressive fluid administration until they're in surgery actually improves survival rates. Just shows how treating these wounds requires quick thinking, but also a deep understanding of how the body responds to trauma.
Even if we aren't doctors, it gives you a glimpse into those split-second decisions, those intense procedures happening in those moments.
Absolutely. It's easy to assume every gunshot wound means immediate surgery, but that's not always the case.
And this is where the next study we'll discuss really threw me for a loop. Get this. 80% of gunshot wound patients in this one center were treated without immediate surgery. 80%.
Now, it's important to note this was in a highly controlled setting, constant monitoring. But it does challenge the assumption that every gunshot wound equals an immediate trip to the OR.
Right, and this is where that whole damage control versus definitive care dilemma comes in, right?
Exactly. Sometimes it's about stabilizing the patient first, addressing the immediate threat, and then addressing the specific injuries.
So it's about the best decision for long-term health, even if it means delaying certain procedures.
It's a balancing act, for sure. But if surgery is needed, things get even more specialized because a gunshot wound It's not your average wound.
Yeah, the specific considerations section in our source gets into some pretty graphic detail about what surgeons have to consider.
And it all comes back to the physics we discussed earlier.
For example, imagine having to think about the damage around the bullet's path, not just on it. Or the fact that the gut is the most commonly hit area makes sense, but still pretty sobering.
And then there's that chilling detail about the even number of holes. Sometimes the bullet's path can seal itself off internally, masking internal bleeding.
So you could have a patient who seems stable externally, but internally it's a whole different story. Scary.
Exactly. And that brings us to another critical point. Infection.
Okay.
Gunshot wounds. They're messy, contaminated injuries.
Clothing fibers, dirt, debris, all kinds of things getting carried into the body by the bullet.
Which is why sometimes leaving a wound open is actually better than stitching it up immediately.
Hold on, what? That seems counterintuitive.
It sounds strange, but it can actually reduce the risk of infection.
Wow. This is a whole other level of medical decision-making.
Absolutely. Gunshot wounds, they present unique challenges, and the long-term consequences, they could be significant.
This deep dive has really opened my eyes to the complexities of gunshot wounds.
It's a sobering reminder that these aren't just plot points in movies. They have real-world consequences for individuals and the healthcare system. And it's not just about the immediate impact. The ripple effects of these injuries, they're far greater than we realize.
You're right. We haven't even touched on things like potential complications from surgery or the long road to recovery.
Exactly. Remember our talk about infection rates? Those are seriously high with gunshot wounds.
Our source mentioned a range of 4% to 31% experiencing wound infections. That's a huge difference.
Goes to show every case is different, right? Location of the wound, the type of bullet, even the patient's overall health, it all plays a role in that risk of infection.
So on top of everything else, doctors have to be incredibly careful about monitoring for infection, choosing the right antibiotics.
Absolutely. And they have to weigh the risks and benefits of different surgical approaches, like whether to repair a damaged colon immediately or delay it. Think about wartime situations. There's a higher threshold for delaying surgery because the risk of infection is so much higher.
Makes sense. Our source mentioned that immediate colon repair during combat has a failure rate of like 16–20%. That's a scary thought.
It really highlights how complex these decisions are, the incredibly difficult situations surgeons often face, especially in emergencies.
And it's not just the colon that's at risk, right? Our source also talked about the potential for empyema.
Right. Empyema, that's a buildup of pus between the lungs and the chest wall. It's a serious complication that can happen with any kind of penetrating chest injury, but the risk is much higher with gunshot wounds.
Because of that contamination factor we talked about.
Exactly. Remember, all that debris carried in by the bullet, it introduces bacteria into the chest cavity, which can lead to infection and potentially empyema.
So we're looking at a bunch of risk factors. A highly contaminated wound, potential damage to multiple organs, and a body that's already been through a traumatic experience.
It's a lot. That's why our source really emphasizes that systematic approach, not just in those initial moments after the injury, but throughout the patient's recovery.
And it's not just about saving lives, right? It's about making sure they have the best possible quality of life afterwards.
Absolutely. Gunshot wounds, they can have lasting physical, emotional, even financial consequences for survivors.
The source doesn't dive too deep into those aspects, but it really makes you think. Beyond the initial trauma, there's a whole other level of care and support that's needed.
You're absolutely right. It's a reminder that these injuries, they don't just impact the individual. It's their families, their communities, even society as a whole.
It really puts those statistics we hear about in the news into perspective. Each one represents a real person with a real life, a real story.
Stories of resilience, for sure, but also stories of loss, of struggle, of the long and often difficult journey of healing.
And those stories, they often don't get the same attention as those initial headlines about the shooting itself.
Which is why it's so important to have these conversations, to dig deeper into the complexities of gunshot wounds and their impact.
To go beyond those sensationalized portrayals we often see in the media and really grapple with the true human cost of gun violence.
And to recognize that the impact of a single bullet, it can reverberate far beyond that initial moment of impact.
So how do we take all of this information and move forward? What are the key takeaways we should be thinking about?
Well, I think the most important takeaway is just recognizing how complex gunshot wounds really are. Our source material really drives that point home. It's not just about the bullet itself. It's the physics involved, the incredibly intricate anatomy of the human body, and the split-second decisions healthcare professionals have to make.
It's about recognizing that these injuries, they're not like what we see in movies on TV. They're messy, they're unpredictable, and they have the potential to cause such widespread damage.
And that's why treating them requires such a specialized approach.
It's not just about patching up a hole. It's about understanding the unique challenges that gunshot wounds present, from the risk of infection to the potential for those long-term complications.
And that level of understanding, it requires a multifaceted approach.
One that involves not just medical professionals, but researchers, policymakers, and everyday citizens like ourselves.
Exactly. Because the only way we can really address the issue of gun violence is to approach it from all angles, to understand the science, the human impact, and the societal factors that all contribute to this complex problem.
So, in a way, this deep dive, it's been about so much more than just gunshot wounds.
It's about recognizing the connection between health, science, and society.
And about using knowledge to spark conversations, to challenge assumptions, and ultimately to create a safer, healthier world for everyone.
That's a powerful goal to strive for.
Speaking of striving, we've got a lot more ground to cover in this deep dive. We're back, diving deeper into the world of gunshot wounds. Before we got sidetracked, we were discussing the need for a multifaceted approach to this issue, going beyond just the immediate medical response.
And one aspect we can't ignore is the role of those, really intense emergency procedures, the ones that come into play right after an injury.
Our source mentioned something called an emergency thoracotomy. That sounds pretty hardcore.
It is. A thoracotomy is basically when they open up the chest cavity, usually to get to the heart or lungs. An emergency thoracotomy, well, it's exactly what it sounds like, performed in those really dire situations, sometimes right there in the ER, even out in the field.
Wow. So we're talking literally opening someone's chest to try and save their life. Talk about high stakes.
It's a last resort, for sure. But sometimes it's the only option.
Our source mentioned a study looking at these emergency thoracotomies, specifically for penetrating injuries, including gunshot wounds. What did they find?
The survival rate wasn't high. But you have to remember, these are usually performed on patients who are already in extremely critical condition.
So even a small number of survivors is a big deal in those cases.
Absolutely. It just shows how far medical professionals are willing to go to try and save lives, even when the odds are stacked against them.
Really highlights the importance of having trained professionals and the right resources available, especially in those critical moments.
No doubt. Quick access to that specialized care, it can be the difference between life and death for someone with a gunshot wound.
Which brings us back to that idea of a multifaceted approach, right? We've talked about the science, the medical response, but there's that bigger picture to consider as well.
Absolutely. We have to think long-term beyond the immediate aftermath of these injuries. What are the effects on the individual, on society?
The physical and emotional scars, the financial burden on healthcare systems, the ripple effects of that trauma. It can impact families and communities for generations.
Exactly. It's recognizing that gun violence, it's not just a personal tragedy, it's a public health crisis. And it needs our attention, our action.
So where do we go from here? What's the final thought you want to leave our listeners with?
I think it boils down to this. Knowledge is power. The more we understand about gunshot wounds, the complexity of the realities, the better equipped we are to advocate for change, to support research, innovation, and policies that actually prioritize safety and well-being.
To challenge the idea that gun violence is normal and actually work towards a world where these tragedies happen less and less.
Exactly. It's a big goal, for sure, but it's one worth striving for. And it starts with conversations like these. Being willing to dive in, ask the tough questions, and demand better for ourselves and for future generations.
Couldn't agree more. Well, that wraps up our deep dive for today. Thanks for joining us on this journey. And remember, keep asking those tough questions.